My name is Bidyalaxmi Thoudam. Today's topic is cover test. Cover test is an optometric test that can help in diagnosing strabismus or squint. It is done for both distance and near. So what is strabismus? Normally, two visual axes of two eyes are parallel to each other in primary position and other position of gaze, but a misalignment of the two visual axes occurs in case of strabismus, and it is also called as squint. Squint or strabismus is again divided into phoria and tropia. Phoria is a deviation where it becomes apparent after the elimination of the fusion stimulus, and it is also called as latent deviation. Tropia is a manifest deviation where the visual axis of one eye is not directed at the object of interest. Cover test is done by occluding one of the eyes and analyze the movement of the eyes. According to the method, it is divided into unilateral cover test, cover and cover test, and alternating cover test. Unilateral cover test is used to detect tropia. Cover and cover test is used to detect phoria. Alternating cover test is used to detect the totality of the deviation in the two eyes. Unilateral cover test. So unilateral cover test is done by occluding one eye and observe the movement of the other eye. For example, while occluding the right eye, we observe the movement of the left eye. If there is no movement in the left eye, we shift the occluder to the left eye and observe the movement of the right eye. If there is no movement in the right and in the right eye as well as in the left eye, then there is absence of strabismus or squint, and the condition is called as orthotropia or orthophoria. Another case, if while occluding the right eye there is movement of the left eye, that indicates the presence of strabismus. So while observing the movement of the eye, we should see some characteristics such as direction of the movement, frequency, magnitude, laterality, and committance. Direction of the movement is helpful in detecting the type of squint. Frequency will help in diagnosing whether the squint is constant or intermittent. Magnitude will grade the amount of squint. Laterality will differentiate whether the squint is unilateral or alternating. Committance will also help in differentiating committant squint or and non-committant squint. So for example, while occluding the right eye, left eye moves, there is strabismus. The direction can be horizontal movement or vertical movement. If the eye moves horizontally, it can be inwards, that is towards nasal side, or it can be outwards, that is towards temporal side. If the eye moves inwards, that is exotropia, and if the eye moves outwards, that represents the presence of esotropia. But in vertical movement, if the eye moves upwards, that indicates the presence of hypotropia, and if the eye moves downwards, that indicates the presence of hypertropia. Now frequency. If there is presence of strabismus, it can be present always or sometimes. If the strabismus is present always, that indicates constant strabismus, and if the squint is present sometimes, that indicates intermittent squint or strabismus. Constant strabismus has higher probability of developing sensory adaptations such as amblyopia, eccentric fixation, suppression, or ARC. Intermittent squint is likely to have binocular vision in the patient. Next type is cover-uncover test. It is helpful in detecting phoria. It is done by occluding one eye and observe the movement of the eye after uncovering. So, while covering the right eye, if it takes a passive position so that when it is uncovered, it needs to move in order to fixate, then we are faced with a phoria. Now let's see the direction of the movement. So after uncovering the right eye moves horizontally, that is, under the cover the eye goes inside, but after uncovering, if the eye go outwards, there is presence of esophoria. So in case of exophoria, under the cover the eye will move outwards, that is towards the temporal side, but after uncovering the eye will move inwards. And for vertical movement, the eye move upwards after uncovering. That indicates the presence of hypophoria. And if the eye move downwards after uncovering to take up the fixation, that indicates hyperphoria. In case of orthophoria, the eye will not move under the cover and after removing the occluder. Last method is alternating cover test. It is used to evaluate the totality of the deviation. So in this, we observe the movement of the eye after shifting the occluder to the other eye. So while passing the occluder from one eye to the other eye, the uncovered eye moves. That indicates the presence of alternating squint. That's it.